Hey everybody, my name is Ethen Ostroff. I am a personal injury lawyer and I represent people who are hurt due to no fault of their own. My job is to make sure that your future personal injury case is protected. Today I'm going to be talking through spinal fusion surgery cases, what they are worth, what it is, why it's important to know about, and why your case might have value even though you wrote your own case off. Before I get to that, make sure to click that subscribe button, follow along where I will make sure that your future personal injury case is protected. So, spinal fusion surgery cases, when they can happen in a routine fender bender, they can happen in a serious crash. Let's say that you are sitting at a stoplight and you get bumped into at 5 miles per hour from a big F-150. Your body was at rest when you got hit. When you got hit, it whipped your neck forward, you go forward, and now you're feeling some tingling in your neck. You got some tingling happening in your fingers. Maybe you're feeling some shooting pains down your legs. And it happened maybe 2 weeks ago, and then the symptoms start kind of coming on. This might be a symptom that says your nerves in your spine have damage, and you need to go get an MRI to make sure that you do not have a serious issue. Now, there are 3 levels of a spine fusion surgery when it's necessary. Some require surgery, some do not. I'm going to go through each level of when you would require this kind of issue. Level 1, back injuries that are the least serious and generally involve soft tissue damage with no permanent impairment. The most common level is through whiplash and back spasms, just like I just described to you. So you had a whiplash, you got hit by a big F-150, maybe moving at even 5 miles per hour, and your body was sitting at rest. You even maybe reached down to grab a cup of your coffee when you were in line for your commute to work, and you got slammed from behind, boom. And you are not feeling like yourself for a few weeks. You go to the doctor a month later, and you are just not feeling like yourself. You're not sleeping right. You're feeling things in your hands and your toes. This is a symptom that may require surgery, may require injections, may require physical therapy. These are the kind of things that people tend to just ignore because they think, oh, I only got hit 5 miles per hour. It can't be that bad. It can be that bad. I've seen clients who have really serious problems from really low impact crashes. Imagine that you're sitting on this chair right here, all right? Imagine you're sitting on this chair, okay? And imagine if somebody comes up behind you and does one of these, and you feel something in your neck. But let's say that someone points to the chair and they say, oh, the chair's okay, so your neck has to be fine. I mean, come on, guys. You know that if you're sitting on a chair, just because the chair's okay, doesn't mean you're okay. Doesn't mean your neck's okay. Doesn't mean your hands are okay. So if you see your car and you go outside and you look at the bumper and that bumper doesn't have much damage on it, that doesn't mean you're okay. It means that you might not be okay. Just because there's not a lot of property damage doesn't mean you don't have a serious injury. Make sure that you go get checked out as soon as possible after you get in a crash. Because if you don't, then guess what? That defense lawyer for that driver that hit you is going to say, well, they waited a month to go get checked out. It has to be something else, has to be unrelated. Don't give them that excuse. Level 2, the more serious usually require extensive medical treatment. This could be a disc herniation, a pinched nerve, and it usually does involve some sort of permanent injury. So if you have a pinched nerve and you're feeling some shock down your hands, you are going to deal with that for a really long time, if not forever. If you don't take care of yourself, you're going to be having these problems for a really long time. Now, level 3, the most severe, can result in permanent impairment or disability. Spinal fractures, dislocated vertebrae are examples of level 3. These only typically occur in high-speed impacts. So let's say you got on a highway and you got slammed into the side by a truck, and you might have broken some bones in your vertebrae. Now, that might be the most serious case you can deal with your vertebrae. You may require a spinal fusion, and your case may be worth a lot, but guess what? You're going through something horrible. I hope you do not go through something like this. If you are, Feel free to reach out to me below. My information's down in the description. Make sure to follow along, hit that subscribe button where I will make sure your future personal injury case is protected. Thanks.